My name is Brianna, and I did my practicum in Yellowknife, Northwest Territories, and at the North of 60 MFRC, which means Military Family Resource Center. So Yellowknife is, I guess, the center of Dene Territory, and it's right on Great Slave Lake, but this practicum actually served a really huge diversity of people. So we were working, whoops, what's happening? Is it timed? We were working with ranger instructors in the military who are instructing Northern Arctic Rangers in mental health, in military operations, and all of these rangers are Inuvialuit, Dene, Slavey, North Slavey, South Slavey. They're from all across the territory. I have a map that you can see later. But just in the introduction of the Military Family Resource Center, I just want to let you guys know that it's not just the city of Yellowknife that we're serving. It's actually the entire, mostly Northwest Territories, but also some communities in Nunavut, some communities in the Yukon, and some of the northern provinces as well. So they're really servicing a really huge group of people with this project. So we were working on targeting mental health crisis intervention at the 1st Canadian Ranger Patrol Group. I'm going to try and get through all of this since we only have 5 minutes, but if you have more questions, because it is really complex, just please feel free to talk to me afterwards. So our objectives were to provide one CRPG with a pocket checklist for patrols, essentially how to deal with mental health crisis when you are in an extremely remote, and I mean no roads, no cell phones, no communications whatsoever. When you're in a remote situation, how do you deal with a mental health crisis? So to provide them with a pocket checklist and to instruct those ranger instructors, the military personnel, on how to identify individuals who are struggling with mental health crises, to instruct the ranger instructors on providing assistance to those people and how to keep records of these things and practice self-care in these kinds of scenarios. So the proposed solution to all of the mental health crises that they're facing, which there's actually a lot, and like I said, I don't have time to go through all of the things that the rangers and the ranger instructors are going through, but we wanted to gather information, so we talked to ranger instructors, we held some coffee times, we offered them some donuts, welcomed them to the MFRC, and just chatted about their experiences. So we talked to them, we consulted with them, we did a bunch of different pilot presentations of the pocket card that you're going to see in a couple of minutes. There it is. I don't know why it keeps skipping ahead on me. And then the final stage is what I'm kind of doing right now is the implementation. So we're slowly starting to get towards presenting this information and keying it in so that the language is appropriate for military and rangers. This is the pocket card, LASER, so it stands for look, assess, listen to their story, explore options, and record. And this is kind of an adaptation of the mental health spectrum that the military already uses, but it was just changed a little bit to have different language and also to be more relevant when you don't know a person. So when you don't know somebody, you can't always identify their behavior as different from how they would typically behave, so we adjusted this to be more appropriate for that group. This is the product that I developed with my coworkers. So to link into the PHSP values, one of the biggest things was the interprofessional and multidisciplinary approaches to practice and research. It was hugely interprofessional because we had military officers, non-commissioned officers, we had a huge variety of different community leaders, both in Yellowknife and in the rest of the territory. So we were really working in a super cross-cultural, cross-disciplinary environment, and so that means that the process was extremely iterative in terms of finding language that works for everyone, communication processes that works for everyone, and a product that everyone can understand. So in that way, it really was community-based. Took a very long time to even just get the wheels turning of developing this product, but I think in the end, the feedback that we're receiving is that before implementing it, the soldiers and the ranger instructors seem to think that it's really worthwhile, and like they're already starting to see some ways that they could help some of the rangers that are in crisis. So what we've seen so far is that engagement and the kind of community-based approach has been effective, but we'll see what the rangers think once they have access to that product. So that's it.
Wow, that was amazing. It's hard to do those presentations in 5 minutes, man. So questions? I'll ask one. I mean, so you said you're getting good response from community and the rangers, and yeah, I know. I think it must have been on auto time or something. Anyway, you said you're getting good response from community and the service providers. I mean, it's an interesting culture to be working in when there's a lot of stigma around being weak, having an illness, et cetera, et cetera. I mean, so I guess that's the question. Are attitudes shifting? Because
so that's actually, it's a really interesting question, and it's one of actually the misconceptions that we, the social worker and I that were developing the product came into the project with, is just assuming that military people don't care about mental health and that they're all about being tough, but it's really not the case. I mean, to a certain extent, they just approach it differently. And so that was kind of part of the cultural learning and part of the kind of, like Charlotte was saying, like humbling ourselves and, okay, how do you guys discuss mental health? Because it's actually something that they do courses every 3 months about mental health. They are mandated to do a lot of training in mental health. They do something called Road to Mental Readiness. That everybody has to do on a very regular basis. So it was interesting more about how they approached mental health. So in the military, it's very biomedical, whereas, so a lot, for example, one of the indicators that we had was if people make jokes about suicide or about dark times, then that's an indicator that they might be in some distress. That would put them in the yellow zone. They said, okay, yeah, in the military population, that's a yellow or even a green, but in these indigenous populations that we're working with, they never joke about that. They talk about it openly all the time, but if they joke about it, they're in the red zone. So it really was kind of just shifted all of our perspectives about how the military feels about mental health, how different indigenous populations feel about mental health, and it was very, very different from how the social workers and academics feel about mental health. So
fascinating. Thank you. What a great answer. Any other questions? I'm doing my scan. If not, then thank you. And